We're ditching the quick fixes and diving deep into what really makes men thrive. You're listening to the Man Unmedicated podcast with Rob Kress. All right, welcome everyone. Rob Kress here with another episode. Great guest today, Dr. Brian Licuanan. Brian, welcome. Brian, you're a board certified psychologist with nearly 20 years of experience working with diverse populations, from individuals to families, organizations, and communities. You specialize in treating a wide variety of issues with a particular focus on substance addiction, which I think is going to come into our conversation today for sure. Dr. Licuanan is a sought-after speaker, educator, and author, empowers families to combat mental health and addiction, and we're going to speak about his actually newly released book that actually speaks to this. Pretty excited about that. He's written this guide for families navigating the challenges of treatment, offering actionable steps and guidance. Dr. Brian is avid in weight and strength training, as well as competes in Brazilian Jiu-Jitsu. Importance of sound grit. Dr. Brian, welcome. Yeah, totally. And I think we've known each other for less than a week, and we were introduced through K Corpus, and we had you on the Soul of Medicine podcast the other day, which was excellent. I can't wait for that one to come out. So y'all got a couple podcasts coming to you that you got to hear. Now, with that one, you brought up, I was saying that we were discussing things, saying how I run the men's group and the men's practice in Soul of Medicine, and you alluded to the fact that it's, Men's Mental Health Awareness Month. And I'm like, I got to have you on. And I think this is going to be a great topic because just like the health of men, it often goes unspoken. And I think this is going to be really good. So I think, this will be maybe a nice step when we're looking at the trajectory. I'm a big fan of the quote by Thoreau: masses of men are living quiet lives of desperation. So does that mean anything to you in your practice, what you've seen? I'm curious.
Yes, it does. And yes, absolutely. The timing of this just was perfect. And one thing I do believe in is not always are things coincidental. I think things sometimes are laid out. Me connecting with Kay the other day was just reaching out to her. I haven't seen her in 30 years. And we connected again through social media. And then I found out what she did. And she said, let me have you on the podcast. 1 week later, we are on. And then she introduced you to me. And like I said, sometimes things just line up the way they're supposed to line up. And so that's just one thing I just want to mention as well. And so I think, like I said, this is great timing.
And I love that because I'm going to drop something that's a little more weird with the timing in here, because I'm not one who believes in coincidences. And I had an old friend that was kind of coming into my mind as of late the last few days. And Kay and I even spoke about him the other day. I'm like, because sadly enough, he took his own life last year. And thank you. And it felt like, I think the timing's coming up. So, and I kept meaning to go back to, it was his brother who alerted me. And I kept meaning to go back to the text to say, when was that date? Right? Because I want to reach out and just to know. So Kay and I were having dinner last night. And I'm like, so I opened up my buddy's text. And he texted me on June 24th, telling me that, hey, buddy, I got horrible news. My brother took his life yesterday afternoon, which would have been June 23rd, which is today. So I just got goosebumps for like the 19th time thinking about that. And so it was a year ago today. So I just want to, one, throw some energy, some acknowledgement that way, but recognize this is a real issue that we're dealing with in our society.
Very much a real issue. And once again, I am deeply sorry for the loss. And, someone taking one's life is a huge impact. Unfortunately, I've seen it happen before, and the devastating impact it can have. And I'm hopefully in our conversation today that we may be able to reach out and help people and to sort of destigmatize that it's okay to talk and reach out for help, which brings me back to the question that you had asked in terms of men and reaching out for help. And does it mean anything to me? And absolutely it does. There are general gender differences between males and females, at least historically. We're starting to see that change a little bit more. But in a general speaking level, women tend to connect with each other intimately meaning a close bond, through dialogue, conversation, sitting down and having coffee, tea, and of the like. Men typically connect intimately through shared activities, shared experiences, whether it be watching a sporting event, going hiking, going fishing, participating in an event. Doesn't mean that males and females engage in less intimacy, so to speak, that close bond. It just looks a little differently. But we're seeing a lot more. I've seen it in my practice. Those lines are starting to become a little bit more diffuse, meaning that we get men that are engaging more in dialogue, intimate dialogue, and females in shared activities. And it's really important in terms of an intimate connection with people. Some research talk about 4 major areas of an intimate relationship, close bond, and dialogue is one of them, along with transparency, vulnerability, and reciprocity, meaning a give and take relationship. But dialogue is important. If we're not communicating, it's very, very hard to create a very, very solid bond. But for men, typically speaking, I do think we still have this effect. I do think culture does still have a role where sometimes as men, we are asked to subscribe to certain types of approaches to things, whether it be the problem solvers, the strong one, the can't be phased one. And there's historical probably underpinning to that as well, where we have to be the head of the household and so forth. But what happens is those same people, when they are not allowing themselves for that self-care, it catches up to them. It eats them away. And that's where you see people become very vulnerable, where they reach a max point and they may engage in activities that lend itself to unhealthiness, whether it be engaging in substances, avoidance. It may manifest that in anger, and sometimes in the worst case scenarios, taking one's life. So I think this is a very, very important discussion for you that you're having, and a great question that you're posing, because there's a lot of people out there who are suffering silently. And this is not just males. These are females and, of course, teenagers and children as well. And one of the things that I think is important is to help engage in dialogue with people. And there's certain ways we can do that. So I'm hoping some of those knowledges will emerge in our conversation today.
In the men's practice, a question I often pose, or a scenario I'll throw out that men usually gravitate to, and I think it was in the words that you were saying, it's like, there's a saying, you're the rock that everyone holds on to, but sometimes the rock gets slippery. So, and a lot of them, it's just like, wow, they haven't heard in those words, and suddenly, and I'm sure you see this, and I guess my question would be, do you see more and more men raising their hands saying, you know what, something's going on, I'd like to talk to you, than it was 10 years ago, 15 years ago?
I do. And especially on the therapeutic level, I'm seeing a lot more. I've been treating people in the therapeutic setting for almost 20 years. And you are seeing a major shift in the people who present to therapy. And you're seeing a lot more males who are coming in who historically wouldn't come in for things that they're struggling with. Like, hey, I'm having some marital issues, or hey, I had this traumatic event. I had this abuse as a young child. And they're coming and they're recognizing that, hey, I can't do this any longer. I can't hold on to this any longer. I need some space to work on, process, or release these things. So absolutely. And that's having a trickle down effect. You're getting other people to come speak, whether it be they're teenagers, and it's a great role modeling for them as well. And I believe everyone has their max point, their breaking point. And it doesn't matter who you are. I think there's different levels of people's max points. And actually, you can train for that. But in terms of being able to cope with certain levels of stress, but we have to recognize that everyone has a max point. And what happens is people just make these assumptions. Okay, let's say, for example, dad, head of the household, man, he's always coming out with solutions. He's always the strong one. And what happens, he falls into this role is I can't falter. I can't show my family that I'm vulnerable. And what's happening, as anybody else, is he doesn't have the permission to express that he's struggling. I think some of the most powerful things that we see that's great role modeling, especially for kids, are that saying that, hey, I'm struggling, I'm having a hard time. And it's more of, how do we get through it? How do we come up with solutions to get through it? I think that's the more important role that we can serve as, whether it be parents, role models, mentors, males, females, or what have you, is saying, hey, I'm struggling, right? But this is how I get through it. This is how I navigate through it. Because when we give this false sense that everything's okay, you fall into this role, and that role can be a lot to bear. And one thing I would like to say too, Robert, is what I see a lot of, especially in a group dynamics. I'm a big proponent of group therapy, support groups, fellowship. And what happens is when someone shares, they don't realize that they're planting a seed and giving other people permission to talk about something. And I see that happen a lot. I work also in residential treatment. And when someone will share something like, hey, I was abused as a kid, all of a sudden the level of sharing they get from other people, it validates them and says, yeah, you know what? I went through the same experience. Or someone going through some gender identity crisis or sexual orientation struggles. It really does. And especially with the men's arena, when someone talks about, especially that I was abused, maybe even in a sexual way, it's like this relief of pressure for people to say, hey, and I can relate. And that's one of the biggest factors I see. And that's why when we're open to sharing, realize we plant the seed for someone else. They might not share at that very moment, but you've planted the seed that, hey, other people are struggling like me. Give them permission to talk maybe at that moment or at a later time. So that's a really powerful thing that I've seen.
Yeah, that is fascinating. And you know what's wild? It's when you think about it, like, I mean, we can go back. I think we're probably at a similar age, but we can go back. So I'll just use the time frame 20 years ago, 30 years ago. And, I think if in that point, if someone thought, okay, something happened to me, I was abused or something happened, they'd almost feel like, and maybe you still notice this, that they were the only one that would happen to. And then there's that loneliness, aloneness, that isolation, talk to, right? There was no one to talk to because it's an embarrassing thing. And I think more of this stuff, as sometimes when you hear about it, it just sounds tragic, and it does hit the airways. It's come to the format of our societal conversation that this stuff has happened. And we've seen plenty of instances over the years. So in addition to that, it's almost like it's lowered the ability to have the conversation or even to listen, to say, you know what? Yeah, I'll go to that group. Right. Because I mean, 20 years ago, no, I don't want to sit around with a bunch of dudes and bang some drums in the woods, because that's all you do. But people come to it with a expectation, would you say?
Yes, yes. In terms of a more positive approach with people being more comfortable coming to it, absolutely.
And the initial thing, because that's usually the hardest thing to step into.
Because our logical brain, and I see this happen a lot in the therapy setting, the treatment setting, is you get these families that logically they know there's other families struggling like us. Let's say they have a loved one, a daughter, a son that's struggling with drug addiction, suicidality, a mental health condition. And when they come in there in a group, they truly feel like there's no one else like suffering like us. And then when they come into the group, like, wow, you have a son that's also struggling with substance issues, or you have a daughter who's also struggling with bipolar disorder. And it's so validating for them. So logically, our brain says that we know there's other people, but emotionally, we feel like we're alone. And so that's one of the biggest factors that sharing in a group dynamic support group can do, is that, like I said, not only allows people to normalize and validate they're not alone, but it allows them to give them that permission to be okay and vulnerable and to share, and they can heal with each other. Not only can you learn from someone else, you can teach someone else. And there's a lot of dynamics that happen on the group level. And for anyone out there, really, really take advantage of that opportunity in any way possible, whether it be a church group, grief and loss group, Alcoholics Anonymous group, an Al-Anon group, any other support group out there. The power of group dynamics is really, really important. And it really helps with destigmatizing and taking away that shame that people harbor, which shame is a huge barrier for people reaching out and asking for help.
And there's so many instances and examples of that. Like, for instance, and I'm just going to go from my pharmacy background, because I spend a lot of time, actually giving alternatives and trying to reduce pharmaceutical use when it's not needed in this population. And, we can just speak of OxyContin. and and I'm kind of curious what you've seen, how it's broken up families, it's crushed lives, because there's a lot of parents out there that have lost children due to this indiscriminate use. They get it from mom. I mean, I've heard so many stories. They grab it from mom and dad's medicine cabinet. They get it at a party. And then I could imagine that's just something that, you know, not my family, right? And how people could almost bury that. And then what do you see from that?
That's a huge conversation that comes up. So opiates, of course, painkillers and so forth is a huge, huge issue. And yes, you're right. People are getting addicted. People are dying or transitioning to other substances. Actually, there was a statistic out there where if you engage in just one regimen, let's say you have a surgery of painkillers, you're 40 times likely to potentially transition to heroin just because of that. And it's a huge issue. And that's why anyone, whether or not you have a family history of addiction or addiction yourself or mental health, you fall under an umbrella of a risk factor. That risk factor heightens when you have a history of substance or family history, or you have a co-occurring substance issue. But if I could back up, what I see a lot and what I share with a lot of families and clients is I do believe, right? I'm going to speak to us as Americans because, as an American myself, is I believe our max point, our threshold, that threshold meaning that ceiling point for discomfort is very low. At least is a lot less. And the reason why I say that is when we're in discomfort or pain, what do? We want to relieve us of that pain, whether it be taking a medication, leave the relationship, quit on the marriage, leave the job, move to another place. And I think that's what we've created is this very, very simple fix. And one of the things I believe in is it's really critically important to navigate through discomfort, pain. For example, anxiety, right? We have, I believe, culturally that we've created this idea that anxiety is bad. Get rid of it at all costs. Take a benzodiazepine, which are anxiolytic anti-anxiety medications. Get rid of it's bad. No, actually, mild to moderate levels of anxiety has a survival function.
Yeah.
Mild to moderate levels of anxiety is what makes you prepare for that job interview. What makes you pack extra water and have an extra battery when you're going on a 3-mile hike. What makes you study the weather forecast when you're about to take out your sailboat in the ocean, right? That level of anxiety is important. It's when it's a high level of anxiety for a long period of time where it becomes debilitating. There are people out there with legitimate pain issues, chronic pain issues. I'm talking about those times where, I feel uncomfortable. The first thing we resort to is the quick fix. And unfortunately, that happens to be under the umbrella of opiates and other medications that are potentially addicting and we can become dependent on. So yeah, it's a really, really huge issue. I'm glad you brought that up.
And speaking to that, and I'm glad you talked about it that way, because, I like the term, you need to feel it. You need to know where you're at. And sometimes it is good that we have pharmaceuticals and whatever it might be to get us out of danger, right? Or just to reduce what we're dealing with, to help us cope in the now. But with the recognition of what's the next step, because we'll see a lot of people coming to us that want off the medications, they want off the SSRIs. And sometimes they'll go cold turkey, then they'll come to see us and say they've been on a sertraline for 100 milligrams for a couple of years, and then suddenly they go off of it, right? I mean, you have this huge inhibitory neurotransmitter that was just flooding your body, numbing you, not feeling, then suddenly you're opened up to not only the pain of the past, but also all this other stimulatory activity that's around you. So would you say there's this trajectory of almost like building muscle, kind of like if we're working out and we're training ourselves, let's use anxiety. Like sometimes, hey, you probably see this and I should probably ask about this, man's relationship to anger. Like most have a horrible relationship. One, they try to bury it, or two, they do it too long and it goes in different ways. But there's that thing where you could feel it building. And it's to this point, I tell people, when it gets here, you're either going to say the wrong thing or you're going to do the wrong thing. Energy needs to move, and I need you to move that soul. And I think a lot of that speaks to that, of how we're numbing, but how do we build that muscle in between?
Yeah, and the muscle in between. Yeah, exactly. Where's too much? If I could talk real quickly, you touched upon it with psychotropic or psychiatric medications. I get a lot of people who believe that once I take it, all of my symptoms are going to be gone. right? I take an antidepressant, an SSRI, all of a sudden I'm not going to be depressed anymore. Or I take an anti-anxiety medication, all of a sudden I'm not going to feel any more anxiety. I said, no. And that's what it does, is it intensifies the symptoms. For example, on a 1 to 10 scale, I like to use 1 to 10 scales. And let's say your anxiety is a 10, which is extremely anxious, 1 being little to no anxiety. It's very hard to function at work, in therapy, in relationships, if you're constantly hovering around a 9, right? It's really hard to do that if you're averaging that on a daily basis. And maybe a medication may put you down to like a 6, maybe a 5, coupled with things like therapy, mindfulness skills, meditation will help do that and reduce that. And that's one thing I want to tell people as well is people have this idea and then they give up on the medications because, oh, it didn't work. I took it for a week and so forth. And so, no, medications are critically important. So I don't want to go on that level because there are people definitely that are appropriate and it's indicated to take certain type of medications to sort of de-intensify some of those symptoms. And research constantly shows when we're talking in the mental health field, when psychiatric medication is indicated, that coupled with some form of therapy tends to have the most consistent and robust outcomes, successful outcomes. And sometimes you won't need the medication anymore, but consistently engaging in those therapeutic skills are going to be critically important for maintaining those positive outcomes. And so, but you're right, working that muscle. And what happens is people just take the medication and not doing anything else. They're not practicing meditation, breathing skills. They're not surrounding themselves with healthy people, and they're just dependent on that medication. And you greatly limit the efficacy or the effectiveness of the medication when we're just relying on one thing. Because it's never about one thing. It's about a multitude of things of why you're doing well or struggling. And there's not just one thing to get better. It's a multitude of things. And medication is just one of those things when it's appropriate.
Awesome. So, we just talked about medication stuff, like challenges with that, but, I've heard it say, the things that we fall into, we use these as adaptations to help us cope through the day. But I always like, if you've ever heard the term pharmacon, it's like anything can be your medicine and anything can be your poison. So it's usually the dose or a relationship to it. So I start to think, okay, modern man getting through the day, quiet life of desperation, 1 drink leads to 2, leads to 3, you're alone. There's issues there. But we can also have a drink in a group setting with people in community, that can actually serve a beneficial purpose. What are some of the common adaptations you see common to you that have been more prevalent? And, things that come to mind, like in our modern day. There's social media, like anything that glares out to you that people lean on too much that take hold?
Yeah, I was going to ask you what type of you're meaning maladaptive coping skills, correct? Yes.
Yeah, and they serve a purpose maybe in a certain amount, but when it goes too far, yeah.
Yeah. You brought up the first one is really important and it's quite pervasive. As you know, the advent of the internet and social media has changed the landscape of how we communicate. And one thing I tell a lot of people is I like to look at spectrums because it's never things are dichotomous, like happiness. You're never just happy or not happy. There's a spectrum of happiness. I'm very happy or I'm mildly happy. Depression, anxiety, it's in a spectrum. And I get this conversation a lot because what happens are when people say social media, the first thing they think of is bad, bad, bad. And it's not necessarily the spectrum. Social media has been hugely impactful for people, for spreading their message, for expanding their business, for connecting with people. Just like anything else on a spectrum, it can also have its other side of things where people rely too much on it. They're not connecting with people. They're fully engaging in it, or they're exposing themselves to repetitive data that's probably not healthy or conducive to if they're struggling in some way. And let's say, for example, you're struggling with some animosity towards the world and you consistently surround yourself with negative news about the world and people hurting each other. What you do is you create this confirmation bias. Confirmation bias is you seek this information that confirms. And on the internet, social media, anything you want, you can find some blog, some group that will confirm that bias. If you want to find anything anti this or pro this, you can find it out there. And that's the dangers is what happens is that we we can easily find data or people to validate that place. But again, on that same note, on a silver lining is if you're looking for positivity, you're looking for people who are struggling, who are being hopeful, you can find that as well. And so everything's on a spectrum. So social media definitely has been some of the factors and barriers for people, and it has an impact. But I also want to say as well, it has a lot of positive impact as well. So that overly working can be one of those things as well. We can overly work. For me, our job is to achieve some type of balance. And whenever we're overdoing something, you have to ask yourself, what am I compensating for? And so anything we do, if we're going to the gym 3 times a day, unless you're a professional bodybuilder, but if you're going 3 times a day and so forth, it's impacting your life and other activities, we have to ask ourselves, what are we compensating for? There's a great saying is that the degree to one's coping mechanism is directly proportional to one's degree of pain. I'll say it again. This is not my own words. I heard this someplace, and I cannot quote who said it, but it's a great saying that's stuck in my tool belt. But the degree of one's coping mechanism is directly proportional to one's degree of pain, meaning that if you're engaging in some coping mechanism is some person, place, situation, or thing that brings balance when we're imbalanced through some life type of stress. When we're engaging in something at high level, right, typically we're compensating for some degree of emotional or physical pain of some sort. And so something to think about too, wow, yes, I've been working 80 hours a week and I don't really need to, and what am I compensating for? Or I'm really isolating from people at a high level. What am I compensating for? Or I'm using a lot more alcohol than I used to. What am I compensating for? And so, of course, substances as well to that conversation. Substances is a really, really huge issue to which people compensate. And one thing that I write about is the reason why people, for example, use substances is because it works, right? 3 words. And I say that all the time with either someone struggling in the addiction arena or family members. I said, do you know why your loved one continues to use alcohol? Because it works for what it was originally intended. For example, someone will engage in alcohol to take the edge off, to sleep better, to be more social. They'll smoke some marijuana to be a little bit more engaging and funnier because it works. But what happens is the more we become dependent, the more we become tolerant, we need more of it, and it becomes counterproductive and dysfunctional. So social media, substances, over-engaging activities are some of the biggest ones that we see how people are starting to cope, whether it be older age to younger age and everyone in the middle.
That's great. Thank you. I want to talk about some statistics because they're pretty alarming. 80% of suicides are males. Now, what I've also read is they tend to take more of an aggressive route, like going to get this done. And at the same time, the level of diagnosis of depression is almost not there. And I think that must allude to the amount of times a man raises their hand and says, okay, I should go to a practitioner to talk. So any thoughts on this? I mean, because there's disparity in the numbers.
Yes. In terms of, suicidality, and those statistics are changing gradually. Historically, middle-aged men were the more heightened, vulnerable population for suicidality. But now we're seeing a lot more kids and adolescents making attempts or actual successful attempts of suicide. And then, of course, females as well. So there are the little gender differences between males and females, generally speaking. Okay, yes, men tend to use more aggressive means, and whether it be using a gun, jumping off, crashing their car. Women tend to be a little bit more of a passive means, but yes, in terms of the statistics as well, that is very true. It's underreporting. There's a lot of underreporting that goes on because culturally, a man being depressed is counterintuitive to what we believe men should be. And back to, if I may talk about that social media part, what I want to highlight as well is the silver lining to social media is the power it has to help people. Whenever there's high profile people, whether it be an actor, an athlete, that talk about their depression, their suicidality, the impact that has on people destigmatizing and letting them say it's okay. Because we usually think of celebrities, actors, athletes, whoever else, these high profile people as above human, so to speak, right? Our rational mind says, no, they're just like us. But on other senses, we think that they don't struggle. They have all these resources and they have these big homes and all the luxuries of the world. How can they struggle? And we know that's quite the opposite. Just know in the field of the work that I've done, I've worked with a whole spectrum of people on socioeconomic status, education levels. You raise the roof on any family dynamic and there's issues, no matter what. Every family, if any family says they have no issues, we've got to reassess that. But when they reach out and give people that permission that we talked about earlier, and they reach out and they talk about it, the passing, the very sad and premature passing of Robin Williams. I remember for 1 week straight, that was so impactful, where obviously Mork and Mindy was my era with him. And of course, we had the not Saving Private Ryan. We had the Good Will Hunting, and then, Good Morning Vietnam. And I remember very specifically when he passed away, there was a little girl on TV and she was crying. And I said, why is she crying? She's so young. Robin Williams is so beyond her generation. It's because truly it was so impactful. But the silver lining to his passing was it created a lot of conversation. Wayne Brady, who's a comedian, after his passing, he talked openly about his depression. And it probably saved him as well. And so I just remember that week, whether it be in the treatment, families, or just in private conversation, his passing, a silver lining to it was really brought in awareness. And so I think social media has been huge for that as well. But yes, men and raising that hand and just saying, hey, and there's just no out there for all the men out there. Trust me, you get online, you get on social media like a TikTok and Instagram, you put mental health. There are a lot of people out there who are struggling, but also recovering. And you can reach out and connect with people. There's a lot of great sayings that are out there, and it's a great way to connect as well. So that's a silver lining I just want to bring that back, circle that back to the social media.
That's good. That's excellent. Well, in talking about different forms of media or resources that we have, I think this is a good segue actually to speak about your book, because you actually have a chapter in there that's dedicated, right? The myth of suicide.
Yes, the myths of suicide. Because one of the things, yes, the book is how to get your resisting loved ones into treatment. So this book was designed for these families who are in crisis. They have a loved one who, for whatever reason, refuses to get help. And if they don't get help sooner than later, something bad is going to happen. They're going to take their own life, maybe as a consequence, take someone else's life, commit a act that may put them in jail forever or put them at risk or whatever else. And so it's what I've found is this missing knowledge and skill set out there for these families that believe they've tried everything and they feel helpless and hopeless. And so the reason why I have a chapter on myths of suicide are that I tell people that there's 3 inevitable consequences to untreated mental health or addiction when people are at a high acute level, is they end up in jail, they end up in hospital, right? Or they lose their life. Being homeless is temporary. Untreated, they'll end up in jail, hospital, or they'll lose their life. And we have to accept as family members and parents, that's the biggest fear of them dying, is that I don't think, as a parent myself, I don't think we can ever accept it emotionally, but we have to accept the reality of it, because that prevents us from taking the help or taking the strategies or seeking the type of help that the person really needs. And so we talk a lot about suicidality. And so there are myths being these truths that aren't really truths. And number one of it is that most people who want to take their life don't really want to die. They just want that pain to stop, the physical and emotional pain. And that's a big one. Sadly, there was research that looked at people who made attempts of suicide. They took pills, they attempted to shoot themselves or drive off a bridge. And many of those people who survived, they reported having a change of heart at the very last second after that attempt. And you think about all those people who had those change of heart, but who were successful in their attempt. And so those are some of the big ones. Another one too, another myth, is that talking about suicide will trigger someone to think about it more. And decades of research have looked at that, and if there's no significant evidence that talking to someone about suicide will trigger them and start planting the seeds to commit suicide, actually it has the opposite effect. Talking to them about it actually opens the door for them to start talking about it and maybe asking for help. So, so those are some of the top myths out there that I work with families. I've several others, but and then people who find themselves, most people that I find that make an attempt, they're in this window of vulnerability, that it's a perfect storm. They're either under the influence of a substance, they have some traumatic event that just happened, they're isolated, they feel helpless and hopeless, and they can get out of that window very quickly as well, just by sometimes asking for help. I had literally people who were wanting to make an attempt. Someone reached out to them, they made a phone call, and next thing you know, they're on this trajectory of getting better. So just recognize, people think that people who attempt suicide, it's this long drawn out process. There are some people, and I think they're outliers, who plan it out and so forth. But most people who attempt, it's a perfect storm, and that perfect storm runs out of rain. It's one of the best things I've ever heard, is every storm runs out of rain. And they just got to get through that as well. So yeah, so those are, I'm glad you brought that up. Thank you for bringing that up. And there are quite a few myths about suicidality, but those are the top ones that I typically see that where a lot of families struggle with.
Yeah, it's fascinating. And the one that you were talking about was, it's what we started with. It's the dialogue, right? And that certainly makes sense. It almost seems to me like don't talk about suicide is almost like it's like that's really not a good intention to do, right? I mean, you want conversation to go, oh, but that brings me to even the topic of addiction. And a lot of times, I'll give you an example. See how you see this, and I'm wondering what the way around this is. You've got a family member, could be the father, I don't know, but they're drinking, right? And then they've got a problem, they drink too much. Then the next day, and this can go with this, I think this is a micro of the macro conversation. This is something that how you do anything, you do everything. It can be found in different areas. But like when they're in that midst of drinking and however they're interacting and they're out of hand, the next day when everything's nice and everything's good and calm, no one wants to bring up the conversation because you don't want to bring it back. So to me, that tells me it's like the dialogue in the groups, in the community, that would be a solution. But do you have any other solutions or tidbits for those? Because I know that's very common.
For example, in that example you give, that next day, that's the perfect time to bring up the conversation, right? When someone's under the influence, they're not cognitively there, they're emotional, they're disinhibited, and they're resistant and so forth. And so, but that next day, you sit down and that person saying, hey, can I talk to you for a second? Hey, you know what? If I have some concerns of what's going on. I feel like when you drink to a certain point, I sort of start to feel fearful for you. And I'm concerned about you and I want to check in on you. And that's the time to have the conversation and yeah, plant the seed to let them know. And, with the people we care about and they may be resistant and so forth, but that would be the perfect time to engage in that dialogue. And that's what happens is, oh, well, everything's fine the next day and so forth. And they believe it's just this isolated incident. And of course, there's a lot of other dynamics. There's denial. There's all these other things. And one thing I say too as well, I know I had those three words earlier, but when I ask family members who have a loved one who are chronically struggling, and let's say, for example, someone continues to drink alcohol, they create a scene at the family get together, and the next day they're back, they don't talk about it because they're fine. And so I said, do you know the reason why your loved one can continue to struggle or do what they do? And I say, because they can. Because they can. Because what happens is when we don't talk about it, we're communicating the message that it's not that bad or it's a normalized issue. And one of the worst things I can hear in our family dynamic is when families subscribe to, oh, that's just John. That's just John. That's who he is. And what happens, or, he's too old to change, or he's just going through a lot. But what we're doing is we're perpetuating and giving them the permission that it's okay. It's not that bad. And so Yes, the dialogue and conversation, and just asking someone, addressing the behaviors is a little tidbit on what I find is the most healthy communication is you identify a behavior, how it makes you feel, and kind of what you're requesting from them. A lot of times we create these labels like, gosh, you're so inconsiderate, you're inappropriate. Let's say someone was drinking a lot at a wedding and you tell them that, you know what, you were so rude and disrespectful. So obviously the defenses come up, but you address the behavior like, hey, when you were drinking a lot and you were yelling really loud, I felt really disrespected by you. What I'd like to do is I'd like to respect that we have a conversation and kind of look at that a little bit more. And so number one, you address a behavior. Behaviors can be changed. And then you express how you feel. No one can ever tell you how to feel or what you feel or don't feel. And you're making requests from someone. And so that's one of the huge ways to get what I call getting to the second base of communication. First base, we get stuck. Defensiveness comes up. You call a name, you get defensive, and we never get past the first base of communication. And a lot of that is but also we want to validate, just to validate means to accept someone's truth. Doesn't mean you have to believe them or agree with them. You just acknowledge someone's truth. Like, hey, look like you were having a great time, right? And, it's just, I sort of felt a little fearful for you because I thought things got a little bit out of hand and you engage in some dangerous behaviors. Hey, can we talk about this a little bit? And when you open that door and addressing the behaviors, how it makes you feel, it really takes away the defensiveness.
That's great. That makes a lot of sense, especially when you address them with the behaviors. I mean, that awesome. I like that in the basis. That's called communication. Yeah.
You use that for anybody, whether it be with a child, whether it be with a coworker, a romantic partner, a friend. It's the model that works huge along with what I call validation. To acknowledge someone's truth doesn't mean you have to agree or believe them, but validate, I believe, is sort of the innocuous way to protect yourself from defensiveness.
Awesome. One thing I want to allude to, we actually talked about it in the podcast the other day with Soul Medicine, and it's how you described, because I started thinking about just different instances. If someone has, you create a system, and the system is the people around them, and you've got the primary people that are the ones that aren't enabling them, right? Because as you said, enabling can be great intentions, but negative effects to it. So who plays the roles? Because a lot of times if you've got someone, so maybe dad's going through all this crap in life and maybe he's drinking too much to drown stuff out. And then everyone's pointing the fingers. It's dad's fault. It's dad's fault. It's dad's fault. So now there's that stigma he gets on him. And then it's definitely not a healing path. But you talked about creating a system. And that, to me, that was fascinating. That was like an aha.
And so this is more relating to when we are at that time of wanting to get their loved one help. And what I talk about is actually on the very top is a coalition, but the primary support system are those people who is identified, are those people who aren't going to enable the person, that they are willing to take responsibility, make changes, and they're willing to maintain the unified vision of what they're trying to accomplish for someone, first course, getting help and whatever help that may be. Right. And so that is a primary support system. I use the analogy that we used the other day of a rowboat, right? And so what happens a lot is that I talked about at the other podcast was usually we correlate the degree of destruction someone's caused or the degree of pain someone's caused is directly proportional to how much work they have to do. Well, you're the one that's been an alcoholic for 10 years. You're the one that broke up the family. So you got to go to treatment, do all the work. Right there alone, you greatly limit the probability of real, true systemic change within that family. And so when I tell family members, let's say on the rowboat, you identify the 5 family members who are, and that's including the person that's struggling, but the other 4 people, it could be a spouse, it could be the parents who are accepting the vision that this is what we're going to do. We're going to stick to the plan. As I tell them moving forward, if there's 5 people, that all 5 of you have to accept, no matter what has happened, 20% responsibility and work 100% on your 20% is because you've all contributed something in some form or fashion. And that person who's struggling has to work 100% on their 20%. what happens a lot is you'll get uh, the person struggling only working 10%, mom's working 60%, dad's working 30%, someone else is working 5%. And what happens is those people that are rowing too much, they're going to get burned out. And sooner or later, it's going to all come. Or the other person saying, screw this, they're only doing 10%, so I'm going to stop rowing as well. And so everybody has to do their part in accountability. And so the primary support system is this very conscious effort in deciding who's going to be in there. And we think, oh, well, mom and dad got to be in there. No, if dad, for example, is struggling with alcoholism, or mom is struggling with her own issues, they may not be in the primary support system. So it's not a default. It's an actual conscious effort to decide who is going to be in that primary support system. But yes, thank you for bringing that up.
Well, yeah, that was an aha I got because I've never heard it that way. And I was like, that makes so much sense. So listen, another thing we touched upon, and maybe you can, because I really believe that part of the trajectory when we're talking about men's health, men's mental health, whatever it might be, is, and it's kind of, I think, endemic of our society. It's lack of purpose. And Brabden, I believe the way you linked it, you've got like these 4 pillars that you speak about, and that was kind of linked to the spiritual part of it. Would that be accurate? Could you share that?
Yes, just for your listeners as well. So I identify 4 major areas where I believe people thrive in life, or if they're struggling, they're not attending to one or more of these. And so there's the physical self. The physical self is our body, what we do with our body, how we treat our body, what we put into our body. Okay, that's the physical health part. Then I also believe there's the mental, which can also be the emotional part, how we think, right? The behaviors we engage in, how we attending to our emotions. There's a social part. The social part are things external of us. Those are relationships, friendships, romantic relationships, career, extracurricular activities, fellowship that we surround ourselves with. And then there's a spiritual part. Spiritual can mean a higher God or a higher being, but it can also mean a greater purpose or meaning in life. And absolutely, yes. And what I find and research shows that people who harbor some level of spirituality, whether it be having a God or a higher power or a deeper purpose and meaning, tend to fare better than people who don't. And it's critically important is in those value and purpose could come in many forms. It could be being a parent in your career. It could be of service to others. And when you wake up, it's sort of the compass into your life. When you wake up and you have purpose, but when you have goals, you have purpose. When you have purpose, that creates meaning. And it's those people who wake up sometimes and they're lost, they're struggling, they don't have any goals. And then they lose purpose, and then they lose navigation. And goals for the day could be coming to work. This podcast today was one of the goals. I'm going to check mark. Going to the gym training earlier today was my check mark. And so goals are critically important, but having purpose and value are those bigger tier things. And you look at any person who are thriving in life, right? You ask them, what's your purpose? What's your purpose and value? And they'll be able to tell you that very, very quickly. One of the biggest things for me, if I may share on a personal note, that it kind of crystallized for me, and although it's kind of built in the work that I do, but for me is having a positive impact on other people in the broadest scope that I can. And that's my value. That's what drives me. And I'm grateful and humbled to know that the work that I do as a psychologist and therapist lends itself to that. Okay. And so individually on a one-to-one basis, but I just always felt like I need to do this on a bigger level, whether it be on a global level. And that's why the book came in and the podcast, like what you share. Another silver lining in social media is you can broaden that message very quickly. And so another silver lining, but yeah, spirituality is a huge factor. And so I'm really glad you circled that back in the conversation.
For sure. Sure. So one thing I want to say, so this, the audience I had, pharmacists, so it's clinicians, but it's also men, right? So it's also lay people. So I just want to speak to you, the healthcare practitioners and pharmacists, and just the importance of such a collaborative effort among practitioners, because oftentimes we keep ourselves so isolated. So I can even speak to the pharmacist realm. And I tell pharmacists in my training group, I tell them to develop a Rolodex, right, of people that they can reach out to. counselors, psychologists, whoever it might be, people that they have, because health it's a holistic journey. There's, as you said, it was never one thing, but sometimes it's never just one aspect of health. So when you can build that team, it is tremendous from a practitioner point of view. Now, can you speak to that, how you see it from the patient point of view that's going through certain struggles?
Yes. Well, if I'm hearing you correctly, and you bring up the big word, the fellowship word, and from the patient perspective, that's, to me, that fellowship are the people you surround yourself with. And it is a very conscientious and diligent effort. Now, there was one speaker that I saw, he said, "Hey, give me your phone. I could tell a lot about you by the people you surround yourself with." And I tell people in treatment, when they're in treatment early on, and I say, "Let me look at you. I bet you if I could look at your phone, let me look at your last 30 people you texted, right? I bet I could tell a lot about sort of your struggle by the people you're communicating with, whether it be a drug dealer, toxic relationships and so forth." But yes, fellowship is critically important. That is I believe, one of the most single predictors for long-term success is you surround yourself with people who are going to make you better. Are you familiar with that longitudinal study? Most um, extensive longitudinal study on happiness. So forgive me for not knowing the name of the researcher, but it's the longest longitudinal study. So longitudinal, of course, meaning a long-standing study. And so they started, I believe, in the Depression era, and they were studying happiness, and they studied people of varying levels of social and economic status. And you can see this on a TED Talk as well. But these were people that were, struggle, low socioeconomic status, middle, and higher. And they did it. And usually with longitudinal studies, right, once it's over, the principal investigators, they pass away, they retire, the study stops. But this is still going to this day, and generationally it's gone on. And they looked at happiness, and the number one most predictor or factor related to people's happiness across all levels of socioeconomic status, culture, education was the quality of their relationships. It wasn't how much money they made, wasn't health, wasn't anything else. It was the quality of relationships. And it's a really, really impactful study. And a lot of people that I talk to, whether it be my friends in my inner circle, is there's a hyper focus on the people they surround themselves with. And so, yeah, so back to you talking with clients and patients, there's a saying, right? If you're going to break a pattern, if you struggle with breaking a pattern, people tend to go to old places, people, situations, or things. And that's what they have to avoid. You have to create new people, places, situations, and things. And so yes. And it's not a judgment on other people. I'm not saying, people aren't saying, "Hey, I'm better than you," and so forth. It's just saying that the relationship may not a good fit for me. You don't take it personal, like, "Hey, you're not a good fit for me," because I said, no, this relationship is not a good fit for me. And so absolutely, fellowship, critically important. I do believe it is one of the most single predictors for long-term success for people, is the people they surround themselves with.
That's awesome. And, that parallels with so many other, studies. Like if you look at the blue zones, right, it's essentially one of the power nine. It's, we already talked about two of them. One is living with a sense of purpose. Another one is your community, putting loved ones first, and actually, who are your loved? Great. Thank you. We can go on all day. This is some good stuff. Now, so what I'd like to, can we talk about some maybe actionable steps and resources? So you've got a family member, maybe you see it in your buddy. It's like, my buddy just, there's this thing, well, no, we didn't have to go that far, but my buddy seems disconnected. Something's going on there. Like, what are some actionable steps that people can see when there's the signs? Because as we said, guys often suffer very, very silently until something really loud happens. Things that can give us clues and some steps that we could take, or resources we can reach out to.
So yeah. And back up a little bit, some signs and symptoms, of course, and especially people you're intimately involved with, is this family members. They know, right? And I have sometimes these clients in treatment, like, "Yeah, my parents had no idea I was struggling or I was using drugs or alcohol." I said, they knew. They just didn't know how to approach you, right? With, like, I have two kids, 16-year-old, 10-year-old, and the moment they're not telling the truth, I know very quickly. those idiosyncrasies, those language, the eye movement. And so people who are intimately involved, they know something's not right. And so I mentioned that as well. But some of the signs and symptoms to really tell are especially the drastic measures, right? People used to communicate with you and they're not. Maybe there's a change in their sleep patterns. Maybe their mood has shifted. Maybe they're engaging in certain behaviors. Maybe they're drinking a lot more than they used to. Maybe there's a lot of things. What I look for people is when there's a lot of externalization, like blaming, anger, stuff like that, avoidance. Those are typical things that I look for, that sort of that sign. Of course, obvious things, sadness, depression, especially if someone's talking a lot of hopelessness, you want to be mindful of that. What's the worth living anymore? They're making drastic measures. So those are some things, but you don't want to jump to the conclusion right away because things happen, life happens. But it's, especially people we're intimately involved with, we kind of know something's not right, especially if something's not congruent with what you know of them. So those would be some of the things I would say to look out for. But one thing I also want to say is there's different ways to connect with people. Sometimes when we ask someone, "Hey man, how you doing?" It's such a casual conversation and people don't know how to answer it. This would be with kids, teenagers, and so forth. But ask them more specific, like, you know, you know, tell me some specific things you've been up to these days. What do you have planned this weekend? Right? Hey, who you been in touch with recently? Hey, man, tell me some of the great things that you're working on right now. Hey, and then from there, when you ask these open-ended questions, but these open-ended questions that have some anchors to it, like specific things, like, hey, tell me some positive projects you're working on right now. It can really open the door for conversations. And sometimes when people tell their narrative, you're able to pick up some pieces along the way. When you say, "Hey, wait, man, what's up? How you doing?" That's such a casual conversation that you may miss something sometimes. And so sometimes being specific with some anchors like that could be really, really important. Some resources, there's a lot of resources out there. Again, a silver lining in social media and the internet. One of the biggest organizations is the National Alliance on Mental Illness. I facilitated a group for them for almost 15 years. They're one of the largest organizations for family members or people struggling with mental health or addiction. It's a great resource. So that NAMI.org, NAMI.org, they're national and global, and they're regional as well. There's blogs, education resources. So that's one resource you can go to. And by the way, with the NAMI, they also have what we call a warm line. So we have a suicide prevention hotline. What happens, you miss a lot of people. Like, well, I'm struggling, but I don't really want to kill myself, but I'm 10 years sober and I'm thinking about picking up a drink. Or you know what, it's Christmas time and I'm not with my kids, I'm divorced, and I'm really sad. So the warm, not a hotline, warm line are for those people who kind of struggling and want to talk, but necessarily don't want to end their life, but they can use that. So the warm line, there's the Depression Bipolar Support Alliance, which is DBSA. That's another one. But there's quite a few resources out there. There's PALS, PALS, that's Parents of Addicted Loved Ones. That's another resource you can look at. But like I said, take advantage of social media in a good way. There's a lot of people that want to help other people out there. So those are some of the ones that come up. But if you do have a loving, struggling loved one who's resistant and you're in crisis, what you mentioned earlier, the manual that I created can really help dispel some of those misconceptions of tough love and rock bottom, which comes from a good place. But I sort of dispel some of these misconceptions and strategies and skills to put them in a point where accepting help is what you're going to support.
I love that. So what a great resource. And we're going to have everything in the show notes. Although, where can people find their book and how can they find you?
Okay, well, you can find the book on Amazon. It's at Barnes & Noble's, my website as well, drbrianlicuanan.com. And there you'll find the book and some of my other media appearances. I'm also on Instagram at Dr. Licuanan and TikTok at Dr. Licuanan. So feel free to, I'm really been amping up posting mental health shorts, like for this podcast. I think there's a lot of great stuff that we discussed. Create that. And I'll be also creating more personal mental health shorts on certain topics that I think are important. So those are some of the ways that you can at least reach out to me as well.
Love it. Love it. Any final thoughts or ideas, things that you want to hit upon?
If anything, number one, to you, keep up what you're doing. I think reaching out to this is huge. And what you and Kay are doing is one of, many important aspects of what I called validating and destigmatizing this issue out there, where most people are feeling helpless and hopeless as they feel alone. And you are making people feel less alone out there. It doesn't matter how successful you are or what have you, is that, there's areas that we all struggle with, and it's okay to reach out and ask for help. And what I also want to say too, my parting message is for family members or people struggling out there, is really have hope. Like, people can get better. I've worked with a lot of people who attempted suicide 24 hours prior to coming to treatment, people who've been engaging in heroin for 2 decades or drinking alcohol for many, many years, are able to get help. This disease, whatever the disease will be, whether it be addiction, whether it be mental health, whether it be the 7 deadly sins, so to speak, whatever those entities are impairing your life, can fracture families. But through the recovery process, I've seen families become closer together and more intimately connected through the recovery process, because everyone is in their own recovery, assuming responsibility and working 100% on themselves getting better. So that's one of my biggest message I like to communicate with families.
That's awesome. Dr. Brian, thank you so much. Thank you for the work that you're doing. It's been an honor and a pleasure to meet you over this last week. And I'm really glad we've been able to start this dialogue, for, to use that term again. So thank you so much. I really do appreciate you.
Thank you again.
Thanks for joining us on the Man Unmedicated podcast. If you're ready to take control of your health and join a community of men who are doing the same, head over to www.manunmedicated.com. And remember, true wellness isn't found in a pill bottle. It's built through real transformation. Until next time, keep pushing your peaks.